on levels of care and basic care in particular. First concept to help understand is there's 3 parts to each level of care, and I also want to help understand what a level of care is. So each part of level of care, and this is for both the practitioner and the practice member, breaks down to 3 areas, and this is how we communicate it to practice members, so this will set the tone before we get into more depth, which is that each level of care really has 3 characteristics. One characteristic is the spinal and neural integrity of that particular patient. Second characteristic is the types of forces that you can apply to the person, and then the third thing is the type of responses the person has. Now, each of those areas comes into what a level of care is and how you define it. So in basic care, for example, there's certain indicators for spinal and neural integrity that you want to see. For basic care, there's certain types of forces that you can apply, and there's certain types of responses that you'll see. And as those types of responses change, you're going to be moving to the next level of care, and that will give you other types of forces that you can apply. And along with that, you want to see certain characteristics change of the person's spinal and neural integrity. Also inherent in the levels of care is that there's a progression of care. We're looking at the person's spinal and neural integrity and subluxation, a lot less of an event and much more of a process. As your visit, or the adjustment or network adjustment session or treatment, a lot less of an event that's happening, but part of a process or part of a cohesive whole. And this is very important to get across to practice members, and practice members will be very excited about that when they realize that there's something that they're gaining each visit, and each visit is building on the one before. So each level of care contains an assessment of the person's spinal and neural integrity, appropriate history, appropriate evaluation relative to the integrity of that person's spinal stability subsystems and how they act in coordination. Then determining progress, physically reassessing self-reported questionnaires, monitoring clinical outcomes as determined by the practitioner and practice member as self-reported. And then you modify every level of care. So understand, you have to remember you're a doctor. So though we might outline this are the things that are characteristic of each level of care, you're a doctor, and as a licensed doctor of chiropractic, you have to determine what's effective and ineffective and appropriate or inappropriate with that individual at that time. So we can lay out a map. However, you may find at any particular time with a person that you may have to, as an individual, work with them in a different area of the map for a particular time frame individual visit. However, we want to give you something that is understanding the territory of the person's spinal and neural integrity progressing. Now, the basic level of care we want to think of as introductory care. It also can be reinitiation of care following trauma, periods of stress, or rapid growth. Now, key thing to that is people have to not see the level of care, particularly basic care, and the practitioner and I portray this as a punishment, or they're doing bad, or they're going backwards. Every high-level athlete that you look at, performer, baseball, basketball, dancing, they always go back to do the basic step. Dancing, they may go back to work on the basic 2-step. Baseball player may go back and not even go back, but just on a daily basis work on hitting a ball off a tee like they did when they were, in Little League. Basketball players are going to shoot foul shots. This is not a going backwards. It's the basic lessons their body has to learn, and there will be times, no matter how long they've had care, where they need to receive the benefits of basic care force applications. And those benefits are about helping the higher brain become more aware of the tension and ease patterns and generate self-organized behavior patterns that can self-regulate the tension. This is also in relationship to enhanced body and life awareness. And understand, enhanced body and life awareness is a constructive survival value. People have to learn that. They've learned that they've learned to disconnect from their bodies, and they've learned to not experience their physiology, and that is actually a destructive survival value. And here's a good way to explain this for practice members, and people always get this. You can have a period of time where you go through a dietary change. You start eating healthier, you become vegan, you get rid of dairy and gluten, and you do that for 3 months, 6 months, a few years, whatever it is. You go on a pizza and ice cream bender, you're going to feel awful. That is because you're healthier. And so now you have a greater awareness, connection to your experience, whereas before, when you ate that stuff all the time, you would not notice anything. Same thing with a person's spine and his nervous system. We want to enhance their connection to their spine, have greater body awareness, because that's a constructive survival value. So the kind of things that happen is the spine becomes more flexible in its range of motion. We promote the alleviation of previous postural and neural adaptations as the person's spine and nervous system becomes more peaceful. Clinical attention is focused on the spinal segments to which the dura attach or in the vicinity of these attachments through the context of the phasing system. Spinal gateways are developed for flexion, extension, those vectors, and a lateral bending vector for each of the 5 phases. So during basic care, you want a person's body to develop the flexion, extension, and lateral bending connection in each of those particular 5 phases that you learn in the basic care program. Chronic tension patterns within the spine are believed to create dominant facilitation patterns, which lead to various adaptations, including a redistribution of tension, redistribution of energy. And you want to also develop the full spinal respiratory wave and self-organization of the spine and neural integrity subsystems at the level of outcomes of basic care. So developing the breath wave and self-organization are part of what you want to see happen. Basic care, generally, all strategies can be achieved in 1 to 3 month time period. So basic care generally is 4 to 12 weeks of care. Recommended during that time period is 3 sessions per week. Now, if you're combining network care with somato-respiratory integration, you could ideally recommend 2 times per week with weekly SRI sessions to combine, and maybe do that with the SRI practitioner. So your recommended time frame for basic care is going to be 1 to 12 weeks. Now, in clinical practice, what I often would recommend people to do, what I recommend you do in your office, is just start with an initial plan of care of 90 days. And they may progress into the next part of intermediate care within that 90 days, and some people may not. I highly recommend you don't say we're going to do basic care for 4 weeks or 8 weeks or 12 weeks, and then you're going to move to 12 weeks and move to intermediate care, because you don't know that that's clinically going to happen. You know, it will transition organically as you're taking care of people. So I highly recommend that you look at a person's reassessment protocol as based on their spinal neural integrity, not the types of responses and not the types of forces applied, but those things will change organically visit to visit as they progress. And I'll explain that more in a little bit. But I highly recommend you do 3 times a week or 2 times with SRI sessions for 90 days. And then during that time frame, the person will probably start to achieve level 2 strategies, and you'll start transitioning what types of forces you're applying as our spine and nerve system is improving, which you're assessing through your reassessment protocols. Now, during that time frame, you want to have general, simple self-education programs. Help them learn about a healthy spine and nerve system. Help them learn about spinal integrity subsystems, what those are. Help relate the concepts of mechanical tension on tissues and nerves, the importance of spinal movement and breath, respiration, greater awareness and participation, have that expand for them with the bioenergetic and emotional intelligences. Also increase the level of awareness of one's spine that accompanies progression through basic care. A re-examination process should be performed in care at no later than 8 weeks. Now, some patients are going to need to receive the benefits of network care, basic care, longer than others. And think of it that way. They need to receive the benefits of developing connection, releasing tension for a longer time frame before we can add additional strategies. Because we need to see facilitation substantially reduced in the spine, or have a greater degree of cognitive awareness of the spine, of motion, of tension patterns. In patients where the level 1 strategies have been challenging, a more rigorous program of SRI may be warranted. You may want to have them spend more time with an SRI practitioner, or you do that with them, or they may need more time working with the SRI workbook or SRI book. Now, going back a second, for the re-examination process, really you don't want to take care of anybody without reassessing them in the initial stages of care within more than an 8-week time frame. Ideally, I would recommend, if you're doing a 90-day time frame like we said, that you do a 4-week, 8-week, and 12-week evaluation, or 3-week, 7-week, and 11-week evaluation. So you're assessing them along the way with different tools and strategies and outcome assessments. Now, a habitual lack of awareness, a habitual lack of integration or processing of bioenergetic or emotional energy cues may require further training. So in an individual. So remember, not cookie cutter, but what's going on with that person individually to help them get the greatest changes in their life and quality of life. So from the beginning of basic care, the person is asked to increase their awareness and focus use of breath, of energy, and movement through the spine and body. Understand their use of the triad of change and help them understand the season of discover. Help them understand those concepts, as well as structure, behavior, and perception, and help them learn how to apply that in their life. And that can be part of your educational program, part of your daily communication. And the patient is asked to continuously assess their own progress in concert with the practitioner. From the beginning of basic care, the patient is asked to increase their awareness of the body's response to specific contacts. So as you increase and go through more visits in the process, you want to be able to, as you apply forces, discuss with them what they're aware of their body's process. Be aware of their changes in spinal musculature, both during the session and between visits, of the ease in movement or the lack of ease in movement, changes in respiration between and during visits, changes in spinal posture and regions of perceived tension. So a very simple communication with this is that we can have on a basic level is to tell them early on in their first couple visits that you want them to pay attention to two key things, and that there'll be lots of things that they'll experience as the nerve system improves and nerve communication changes, as well as active passive subsystem changes. But the two things we want you to pay attention to most are breath and posture. We don't want you to try to change either of those educatedly. However, on the table, I want you to really tune into what is your breath doing in terms of depth and range, and also pay attention to that between visits. Posture, same thing, especially between visits. What's your body doing when you're sitting, standing, walking? Don't try to change it. Let innate drive the show. However, you also want to pay attention to what your body's doing, make notes of those changes, and some of those changes may feel good, some may not feel so good. And then also pay attention to posture on the table and how you are when you're laying down. Pay attention to regions of perceived tension. Are they shifting or in the same area? Assessments by the practitioner, static assessments of the spinal integrity subsystems. These are the things that you assess at your outcomes. And what kind of things are static assessments? Posture is a static assessment. Weight balance scales are a static assessment. Posture photos, x-rays, EMGs, thermals, those are static assessment. Active assessment might be a dynamic EMG, or there's an active assessment where you're doing an active assessment of the person's subsystem responses. Increased energy and efficiency and spontaneously developed energy dissipation strategies. Changes in the quality of the spinal rhythm associated with respiration. If the rhythm of their respirations in different areas, depths, regions, pointing those things out. Release of facilitated focus. If there's been an area that's been chronically facilitated, if that's changing. Additional assessments by the practitioner, the development of precognitive awareness, the level of SRI skills, their assessment of wellness, the use of bioenergetic and emotional intelligences, implementation of the triad of change for the season of discover. By assessing these things that we've just gone over at different points, both visit to visit and at reassessments, and determining what tools you're going to utilize in each of those things, you can have progressive reassessments that don't have to do with a person's symptomatic changes, but the changes of their spine and neural integrity, and how they present in terms of function in different areas of their health. And then this creates a much deeper conversation about how the person's doing. You want to get where their question of how am I doing that people ask is your favorite question to answer rather than the question to dread, because you have tools that you're measuring it. So make the question, how am I doing, doc, your favorite question, because you have objective outcome assessments for knowing exactly where they are and how they're progressing and where the person's going to get to next.